Hi, my name is April, and this lesson is going to be about the badminton overhead forehand stroke in multiple sclerosis. The objectives for this lesson, we'll be going over the basic overview of multiple sclerosis, badminton, the badminton overhead forehand stroke, and the adapted badminton overhead forehand stroke, and then I'll be going over my SOAP plan. So what is multiple sclerosis? Multiple sclerosis is commonly known as MS, and it is a disease within the central nervous system that disrupts the flow of information within the brain and between the brain and the body. The immune system causes inflammation that damages myelin, also known, as well as the nerve fibers themselves. The cause of MS is still unknown. Scientists believe the disease is triggered by an as yet unidentified environmental factor in a person who is genetically predisposed to respond. The progress, severity, and specific symptoms of MS in any one person cannot yet be identified, or cannot yet be predicted. Most people with MS are diagnosed between the ages of 20 and 50, with at least 2 to 3 times more women than men being diagnosed with the disease. Some of the symptoms include fatigue, numbness or tingling, weakness, dizziness, and vertigo, sexual problems, pain, emotional changes, walking difficulties, spasticity, vision problems, bladder problems, cognitive changes, bowel problems, and depression. Some of the treatments include medications such as chemotherapy, anti-inflammatory, immunosuppressive drugs, and steroids. Some therapies include counseling, support group, physical therapy, and acupuncture. Self-care treatments include physical exercise. Some specialist treatments are also necessary, such as a neurologist, speech therapist, occupational therapist, clinical psychologist, physical therapist, and then of course a primary care provider. So what is badminton? Badminton is a racket sport played using rackets to hit a shuttlecock, also known as a birdie, across the net. The common forms of this game are singles with 1 player per side and doubles with 2 players per side. Points are scored by striking the birdie with the racket and landing it within the opposing side's half of the court. Each side may only strike the birdie once before it passes over the net. The play ends once the birdie hits the floor, or if a fault has been called by the umpire, service judge, or the opposing side. Each game is played to 21 points. A match is the best of 3 games. So what is the badminton overhead forehand stroke? The badminton overhead forehand stroke is a very common stroke and is the most often used stroke in badminton. This is typically the first stroke learned. The stroke generates the most power. The power of a badminton overhead forehand stroke comes with the correct technique, not how much strength you exert into the swing. The larger the swing motion, the more momentum generated. The overhead forehand stroke is broken down into phases. The first phase is the preparation phase, which is the attacking stance using the proper forehand grip. The second phase is the aiming phase. The body should face sideways, not the front. Move the racket arm towards the back and extend the chest to the widest extent possible to ensure you can do a full swing. Inhale as you stretch and extend your chest to the widest extent. That helps to become more comfortable. Lift the non-racket arm as you stretch your racket arm towards the back. The non-racket arm plays an important role in maintaining body balance. Body balance is very important in badminton. Without good balance, there is no way you can execute the correct technique for this stroke. The next phase is the preloading phase. When you're about to perform the stroke, stretch the non-racket arm. Stretch out your non-racket arm in a natural motion. Avoid swinging it forward. Once your non-racket arm is straightened, swing the racket arm forward. The swing should be one smooth downward motion. Perform a full arm swing to generate maximum power. As you swing your racket forward, your non-racket arm should naturally return to the body. After making contact with the birdie, follow through with the swing. When you complete a full swing, the body should be facing the front. The racket should end up at the lower front area of the body. For the adapted badminton serve, There are many ways to adapt stroke. There are many ways to adapt this stroke. One of the simplest ways is to change the equipment used. Instead of using the regulation rackets and birdies, you could use lollipop rackets, foam balls, and miniature beach balls. You could also lower the net and play on a smaller court. You could adapt the badminton to be seated badminton, where everyone sits on the floor, much like sitting volleyball, or everyone could be in wheelchairs if one individual is playing in a wheelchair to make it more fair. Now I'll be going over my sit plan. For the subjective section, the patient is going to be a 65-year-old woman named Jane Doe who has multiple sclerosis. For the objective section, the patient has difficulty walking, muscle weakness, stiff muscles, difficulty speaking, and is unable to rapidly change motions. For the assessment section, as stated before, this patient has MS. For the plan section, the equipment needed is a towel, various resistances of resistance band, the shallow end of a pool, roughly 4 to 4.5 feet, lollipop rackets, regulation rackets, birdies, miniature beach balls, and an assisted chairlift. We will begin in the clinical setting to warm up the muscles. We will be focusing on the gross motor movements of the upper body. The patient will complete the following exercises. The first exercise is the pendulum stretch. The patient will stand with support as needed and lean ever slightly. One arm will hang down freely. Swing the arm in a small circle, roughly a foot in diameter, and perform 10 revolutions, and then switch. The second exercise is the towel stretch. The patient will hold one end of a standard-sized hand towel behind the back, grab the opposite end with the other hand, and hold the towel in a horizontal position. She will use the right arm to pull upward and stretch. She will complete this 10 times, then switch. The third exercise is the finger walk. The patient will face the wall 3/4 of an arm length away, reach out and touch the wall at waist level with the fingertips. The elbow is going to be slightly bent and slowly walk the fingers up the wall until the arm is raised as far as comfortably able. The fourth stretch is the cross-body reach. For this, the patient will be seated and use one arm to lift the other arm at the elbow and bring it up across the body with gentle pressure to stretch the shoulder. Hold for 20 seconds, repeat 10 to 20 times, switch arms and repeat. There will be physical assistance as needed. The fifth exercise is going to be the armpit stretch. The patient will be seated. The occupational therapist will have the patient straighten arms out as straight as possible, horizontal to the ground. The occupational therapist will gently push arms upward while still remaining straightness at the elbow and stretch the shoulder. She will hold for several seconds and repeat 10 to 20 times. The sixth exercise is the outward rotation. Hold a rubber exercise band between the hands with elbows at a 10-degree angle close to the sides. Rotate lower part of the arms outward 2 to 3 inches and hold for 5 seconds. Repeat 10 to 15 times, and then switch arms and repeat. The last exercise is going to be the inward rotation. The patient will be seated next to the closed door. Hook one end of a rubber exercise band around the doorknob. Hold the other end of the band in the hand and hold the elbow at a 90-degree angle. The patient will pull the band towards the body 2 to 3 inches and hold for 5 seconds. Repeat 10 to 15 times and then switch arms. After the upper body is warmed up, we will be getting into the pool to complete the rest of the session. There will be at least 2 assistants for hands-on assistance as needed and to help with the transfer to the pool. The patient will have assistance changing into the proper attire if needed, and then we'll get into the pool using the assisted chair lift. Either the occupational therapist or occupational therapist will already be in the pool for assistance. The first exercise will be to get the patient comfortable using the lollipop racket. She will be standing in the pool with assistance if necessary and will have a lollipop racket. Someone will toss the softball-sized blow-up ball, and the patient will attempt to hit the ball back. The patient will do this 10 to 15 times or until comfortable. The next activity will be used to get the patient comfortable with the overhand forehand stroke. She will still be using the lollipop racket and the blow-up ball. The occupational therapist will toss her the ball, and she will attempt to hit the ball back, specifically using the overhead forehand stroke. This is under the assumption that the patient will be able to raise the forearm above the shoulder. We will then have the patient attempt to hit the ball over the net using the overhead forehand stroke. The occupational therapist will toss the ball, and the patient will aim to hit the ball over the net. Once the patient is comfortable doing this, we will then attempt to play a game of badminton in the pool, specifically using the overhead forehand stroke. If the patient is very comfortable using the ball and lollipop racket, the patient will be able to use the regulation badminton racket and the birdie. After playing a game of badminton, the patient will get out of the pool with assistance using the assisted chairlift. Once the patient is dried off and changed back into her daily clothes, the occupational therapist and patient will meet back in the office area. The occupational therapist will ask the patient her opinion on the day and ask for any suggestions she may have so that they can make any necessary changes for future appointments. And that's the end of my presentation.